Why can't people afford healthcare insurance? The results of the cost-sharing revolution in healthcare, the decades-long shift of an increasing share of medical expenses onto patients, even for those with insurance, are not encouraging. A new report from the Los Angeles Times and the nonprofit Kaiser Family Foundation finds soaring deductibles and medical bills are pushing millions of American families to the breaking point, fueling an affordability crisis that is pulling in middle-class households with health insurance as well as the poor and uninsured, Noam Levy of the Los Angeles Times wrote Thursday. Levy said that annual deductibles in employer-based health plans have nearly quadrupled in the last 12 years, and now average more than $1,300. However, more than 40% of workers in high-deductible plans lack the savings to cover such an expense. As a result, a significant number of Americans with job-based insurance are cutting back on household spending, delaying doctor's visits or skipping care entirely. Some key numbers from the Kaiser Family Foundation LA Times survey: 25% of workers say they or an immediate family member struggled to pay their medical bills before meeting their deductible over the last year. 26% say they cut back spending on food, clothing and other basic items to pay for healthcare costs. 33% say they postponed needed care in the last year. 20% say they or an immediate family member struggled to pay surprise medical bills. 19% say they used up all or most of their savings to pay for care. There has been a quiet revolution in what health insurance means in this country. This happened under the radar while everyone was focused on the Affordable Care Act, Kaiser's Drew Altman said. We forgot that most people get their insurance through an employer, and for them, the issue is medical bills that they increasingly cannot afford. Because, in the United States, it's not really about healthcare. It's about profit. There are so many middlemen getting rich off of the sick. In the United States, there seems to be an attitude that only some people deserve healthcare. Poor people die unnecessarily. They can't afford to get help when their illness is in the treatable stage. They can't afford treatments because of copays and deductibles. There is a large portion of the population that are really okay with this. It is sad and disheartening. They are so concerned that someone they deem unworthy might get the help they need. How dare my tax dollars help someone else? Even though, for most people, they would end up in the same position because though they paid higher taxes it would be offset by no longer paying premiums, deductibles, copays, etc. I'm a federal employee and have a coworker that rations her son's asthma medication because she can't afford it. The insurance doesn't cover it. My mother is a teacher and a fellow teacher didn't get an advised X-ray because she couldn't afford the deductible. The aim of the U.S. health system is to extract as much money as possible from the population. Getting people sick on an industrial scale to increase profits is part of this policy. Having a healthy population and keeping the costs low and affordable is not part of the deal. There was a guy called Adam Smith who said that leaving everything to the market was not the best idea. Any modern self-proclaimed Western liberal will tell you he was just a socialist loony. Because of consumer demands and government regulations that require coverage for almost everything imaginable. It really has little to do with health care or insurance anymore. It's primarily a mandatory cost-sharing program. By definition, you cannot insure against something that has already happened.